Hello everyone, welcome to Whiteboard with Merhi in 3 minutes. Today we're going to talk about part 2, PCOS. Last time we talked about how to diagnose PCOS and what complications there are, and we talked about how you might have PCOS and you don't know it. So when Sandra and John were in love and Sandra doesn't know, the doctor did not diagnose her well with PCOS, and now we figure out what her issue could have been. But let's come to talk about the causes of PCOS. It's impossible to know the causes of PCOS, and if you are able, or any of you is able to decipher the cause of PCOS, guess what? You'll go in the history books, because right now the National Institute of Health spends millions of dollars to try to figure out what causes PCOS. The most common hypothesis is that there's a problem with the insulin receptor, which is linked to the development of diabetes. As far as the types, there are 2 types of PCOS. Type 1, which is, it's not named one, but the first type is typically overweight women with extra hair on their face. But you can be skinny and still have PCOS, and that's called lean PCOS. So it doesn't mean if you're not overweight and with hair on your face, you don't have PCOS. Very important. Now, it's also extremely important to know that ethnicity plays an important role in the severity of PCOS. And unfortunately, African American women and Hispanic are more likely to have PCOS with bad symptoms, such as those that we talked about in part 1. So why? We do not know. Like anything else, ethnicity is very important in the diseases and their treatments. Now let's talk about the treatment. PCOS is actually one of the easiest things to treat as far as pregnancy. We can give pills such as letrozole and clomid to make the patient ovulate, because there is no regular ovulatory events, and we tell her when to have intercourse and gets pregnant. As far as the metabolic problems, very commonly we give a pill called metformin, which is diabetes medication, but we still give it in order to prevent the patient from going into full-blown diabetes, and that also could help with a lot of other symptoms. If a woman is not having periods, we recommend that she sees an endocrinologist so she can shed the lining at least once every 3 to 4 months to prevent the occurrence of endometrial cancer. But guess what? If Sandra had PCOS and she might not know it, then it's very hard to give her the treatment for PCOS and get her pregnant. And then she doesn't know why she's not ovulating properly. And this way, Sandra, John, and I are gonna be very, very unhappy needing a drink.